Fallout from the pandemic highlighted numerous health issues in desperate need of some serious attention, one being mental health.
But often in communities of color, discussing the issue is taboo. Mental health professionals are trying to change that mindset.
Senior health correspondent Monica Robbins takes a deeper look at the issue and the barriers in the way.
You know, we don't air our dirty laundry. We don't talk to outsiders. We'll just keep it in the family.
Dr. Shavonna Childs is a psychologist with Cleveland Clinic. As an African-American woman, she understands the hesitancy some minorities have towards seeking mental help, but it's vitally important to change that mindset.
Well, sometimes keeping it in the family is killing the family line. And by that, I mean passing on mental health issues from one generation to the next.
According to Mental Health America, more than 13% of Americans identify as Black or African American. Of those, 16% reported having a mental health issue last year. That's more than 7 million people. In the last year, there were far more triggers than just the uncertainty, isolation, or grief from financial or personal losses in minority communities regarding the pandemic. The constant media coverage of police brutality cases, divisive political comments, and blatant racist attacks add complex layers to an already stressful time.
We have higher rates of anxiety. We have higher rates of depression, stress, higher rates of suicide. We're experiencing post-traumatic stress disorder. All of this is hitting the community, but again, in African-American communities, it is at a much higher level, as well as for Hispanics and women.
According to the American Psychiatric Association, only 1 in 3 African Americans who need mental health receives it. And overall, African Americans have lower rates of using mental health services and prescription medications, but higher use of inpatient services. And while rates of depression among Blacks and Hispanics are lower than whites, depression among minorities is likely to be more persistent. And when it's a clinical diagnosis, many don't realize it's out of their control.
Sometimes it's a chemical imbalance. If we have bipolar disorder, schizophrenia, schizoaffective disorder, those aren't things that you have control over. Those are chemical imbalances that require medication so that you can have a functioning life.
Another issue, there's a need for more minority mental health providers because lack of cultural understanding may contribute to underdiagnosis or misdiagnosis in people from diverse backgrounds. That includes language.
People will say, you know, I've not been depressed, but I've been really sad for the past couple of weeks. That's a sign and symptom of depression. Not eating well, sleeping, oversleeping, sleeping too much. Anxiety, being hypervigilant, being startled easily, being worried, having this doom and gloom sit over you and not know where it's coming from or why.
Help is available and needed now more than ever.
Mental health, that trauma can be a generational thing, and we have to know where to stop and step in and break that cycle. And part of breaking the cycle is reaching out to a trusted loved one, our pastors.
Monica Robbins, 3 News.
Now you can hear more of Dr. Child's interview on the Health Yeah with Monica Robbins podcast. Find it everywhere you get your podcasts, and please subscribe. Dr. Childs also provided Monica with a list of African-American therapists in the greater Cleveland area that you could find at WKYC.com.